If you're worried about your hairline and you think you may be at the Norwood scale too, then in this video today I'm going to be showing you how to reverse that, so stay tuned. Hey guys, Leon here and welcome to the Hairguard YouTube channel. On this channel we create science-backed videos just like this one, teaching you how to regrow healthy hair and combat hair loss. If you're new here, consider subscribing. So what we're going to look at today in this video is I'm going to be talking to you about what the Norwood hair loss scale is and what each classification means. Then we're going to talk about how you can distinguish between a natural matured hairline and classifiable hair loss. Then we're going to talk about some of the causes of Norwood 2 hair loss, and then I'm going to show you exactly how to stop the hair loss, lower your hairline and get it back to its natural state. First, what is the Norwood hair loss scale? The stage of hair loss which you're currently classified at has a large impact on the treatment methods you should choose. This is why it's important to have a clear understanding of each hair loss stage, as well as what you can do to slow the loss or even completely reverse it. First things first, what is the Norwood scale for hair loss? Well, it was developed in the 1950s and later revised in the 1970s. The Norwood hair loss scale is a classification method which determines patterns of hair loss. Within the scale, there are 7 major classifications and 4 minor variants. When utilised by a professional, you can obtain a classification which determines at which stage in the hair loss process you currently are. So first is type 1, which is little to no hairline recession. Type 2 is a triangular, typically symmetrical areas of frontotemporal hairline recession. Type 3 is deep, symmetrical recession at the temples that are bare or very minimally covered by hair. Then type 4, you've got a worsening frontotemporal recession with little to no hair on the vertex. Type 5 is the hair loss seen in the frontotemporal and vertex regions, and they're still separate but they're becoming less distinct from each other. Then you've got type 6, which is the frontotemporal and vertex hair loss regions are not combined, with only sparse patches of hair remaining between the two. Then finally type 7, which is only a horseshoe pattern of hair remains wrapping around the back and side of the heads. The rest of the head is bald. Now, when it comes to Norwood 2 hairline, is that natural recession or is it a precursor to balding? So there's a bit of debate surrounding hair loss classifications. This is true even when discussing a descriptive scale, one which provides very clear guidelines such as the Norwood scale. So is a hairline which can be classified as Norwood 2 a natural recession, or is it always indicative of future balding? Well, it really depends on who you ask, but before digging any deeper, let's define natural recession. As you age, the hairline naturally recedes. This is known as a mature hairline, but it in no way indicates future hair loss. Instead, a mature hairline simply gets rid of the more rounded hairline features seen in the young and provides a more distinct shape. But when does a hairline go from mature to receding, and how can you tell? Well, a mature hairline can move back altogether, or you may notice a few spots which recede more than others. When you begin to notice rapid recession in the temples, though, is when you may need to consider that baldness could be a possibility for your future. So back to Norwood 2, is it natural or a sign of progressive loss? In our opinion, the Norwood scale is quite clear in defining Norwood 2 as a stage in the hair loss process. The main thing which separates a mature hairline from a Norwood 2 hairline is the triangular recession seen in the temporofrontal region. Yes, this can happen as your hairline matures, but if the recession continues, then it's likely a sign of more hair loss to come. So, what are the causes of a Norwood 2 hairline? While there are plenty of hair loss causes, including stress, illness and medications, the Norwood scale focuses on one of the most common causes, male pattern baldness. Medically referred to as androgenetic alopecia, male pattern baldness is a chronic form of hair loss, most commonly seen in men. Pattern hair loss can also occur in women, though the pattern differs quite a bit. To best treat the hair loss, it's best to understand exactly what leads to it in the first place. In simplest terms, male pattern baldness can be attributed to sensitivity to dihydrotestosterone, which is the byproduct of testosterone. Now, in all individuals, DHT travels to the scalp and interacts with the androgen receptors. These are found at the base of the hair follicles, and they're seen in greater abundance at the temple and forehead region. In individuals with DHT sensitivity, however, this interaction wreaks havoc. It can lead to inflammation of the hair follicle, which eventually leads to hair follicle miniaturization. In the end, the follicle is too damaged to do its job, and hair is no longer able to grow. As mentioned, androgen receptors are most abundant in the temporofrontal region of the scalp. This is why hair loss is most commonly seen in these regions, as shown in the Norwood Scale, and why the Norwood Scale is so effective at diagnosing male pattern hair loss. So, if you're worried that you're suffering with Norwood 2 hairline, don't worry, I'm going to show you some ways that you can treat it right now. The good news is, if you're classified at the number 2 stage, then your hair loss hasn't progressed to a point where reversing its effects is impossible. Instead, you're in a good position for stopping hair loss in tracks and growing healthy hair. There's 2 key elements of doing so, and they involve stimulating the hair follicles and removing DHT from your scalp. So, first, stimulating the hair follicles. Depending on how long you've been in stage 2, you may be able to lower your hairline back to its original position. This will depend upon the quality of the hair follicles, however. Now, to get started, we recommend mesotherapy and scalp massage, 2 natural methods for stimulating the growth of new hair. As you can imagine, blood flow is crucial to the health of the hair follicle. Without proper flow, the follicles don't get enough of the vital nutrients they need. Both mesotherapy and scalp massage works to increase blood flow to the hair follicles. However, they both go about it in different ways. Mesotherapy works by stimulating the scalp with tiny needles. These needles create tiny perforations which induce healing and promote the growth of healthy new skin and hair. Scalp massage, on the other hand, is an entirely external process and involves the massaging of scalp tissue. The next thing you can do is remove DHT from the scalp. So if DHT is the main cause of male pattern hair loss, then removing DHT from your scalp is certainly a step in the right direction. Over time, a plaque builds up on your scalp. This contains oil, dead skin, hair products, and even DHT. When this plaque remains on your scalp, it continues to cause harm to the follicles. Fortunately, removing this epidermal plaque is quite simple. All you need is a few ingredients and you'll be ready to go. What you'll need is some Himalayan or Celtic sea salt, some powdered activated charcoal, ginger and cucumber juice, and a whole lemon juice. What you do is juice the ginger and cucumber and then combine 100 milliliters of the mixture with salt, charcoal, and lemon juice. Then mix it in the container of your choice. Apply the mixture to the area of your scalp you'd like to target the most. In this case, it's probably going to be the temples and forehead, and massage it gently and then allow it to sit for 5 to 10 minutes. Rinse it thoroughly with lukewarm water and gently finish peeling the rest of the mixture from your scalp. You may repeat this process as many times as you feel is necessary, though we wouldn't recommend doing it more than 2 times per week. And then when we're talking about mesotherapy, what we recommend is about 5 minutes of scalp massages per day. As blood flow is one of the most important factors for whether your hair falls out or not, for this reason scalp massages and exercises can be one of the most effective ways to increase blood flow and stop any further recession of the hairline. To keep things simple, we recommend 5 minutes per day of scalp massages all over the head to loosen the scalp and reduce fibrosis and calcification, which are the 2 factors that reduce blood flow over time. In fact, massages can be so effective that they can restore your hairline to normal within 6 months when done consistently and in the right way without any other treatment. Now, while it's possible for a Norwood 2 hairline to be a result of hairline maturation, it can also mean that more hair thinning and loss is in your future. As outlined, there are ways you can As outlined previously, though, there are many steps you can take to not only stop the hair loss, but also reverse it and lower your hairline back to its natural position. So guys, that's what we want to share with you today on the Norwood 2 Hamilton scale and how to reverse it. Don't forget to hit subscribe, and I'll see you in the next video. Thanks.